Welcome back. Today, our topic is on irregular menstrual cycle. And this is part of the Integrative Women's Health Program. A typical case, Dr. Wang Mianzi, a professor in China, had presented a case of 32-year-old having irregular menstrual cycle for several years. And along with that, she also exhibits dizziness, restlessness, poor sleep, pelvis is cold to the touch, there's leukorrhea, her back is sore, chest tightness, there's some hypochondria tightness, has used Chinese herbs focused on pacifying the liver, activating the blood, but there seems to be no relief. And further aggravate the symptoms while the cycle is still irregular. The pulse is wiry. The left cun position is small. The right ci position is deep. The tongue is pale, and the coating is white, thin white. So that's kind of like a typical case of an irregular menstrual cycle. Frequently, besides menstrual cycle irregularity, a lot of time, you're going to see a lot of liver chi stasis symptoms. But in this case, it doesn't seem like the chi stasis herbs that help to relieve chi stasis work in this situation. So we'll take a look at what Dr. Wang does in this case at the end of our session here. So the definition is that of irregular menstrual cycles, menstruation occur either earlier or later than 7 days for 2 to 3 consecutive cycles. And from the classics of Complete Book of Jinyue Quan Su, we originally called this a deranged menstruation. And later on in Dr. Hu Qinzu's gynecology, he basically said that irregular menstruation is really due to liver kidney disharmony and stagnation, and should use a formula called Din Jin Tang to soothe the liver, soothe and strengthen this kidney qi, and to tonify both the liver and kidney essence to treat this condition. So what are the known causes of irregular menstruation, irregular menstrual cycles? Well, it's similar to early menstruation as well, delayed menstruation, such as adolescence, uncontrolled diabetes, eating disorders, hyperthyroid, hypothyroid, hyperprolactinemia, medications such as anti-epileptic drugs or antipsychotic drugs, perimenopause or premature ovarian insufficiencies, polycystic ovarian syndromes, even pregnancy itself can start to create irregularity in that particular time, and not at least stress and travel. So if we look at etiology, the Chinese medicine are really big on emotional stagnation. A lot of times when there's emotional trauma or emotional stagnation, especially anger, can injure the liver. And when the liver is injured, the liver qi is deranged. And in that particular situation, the patency of flow start to become dysfunctional, and that can cause sea of the blood dysfunction. So the flow is kind of weird and unstable, so we get this irregular cycle. Then the other etiology is the kidney qi insufficiency. And this could be chronic, this could be constitutional, and this could be major illnesses that cause injury to the kidney. And this is where you have weakened the kidney qi. And when you have a weakened kidney qi, you're going to have dysfunction of regulation of Chong and Ren channel. So the feeling of this sea of blood is not stable. Sometimes feels nicely, sometimes doesn't feel nicely. So you can cause sea of blood dysfunction. So these are the two main etiologies to this condition. So again, emotional factors, constitutional factors can all cause this liver qi stasis as well as kidney deficiency. And one affects the patency flow, and one affects the dysfunction in storage, and both cause tonal irregularity, sea of blood irregularity, and causes irregular menstrual cycle. So the diagnosis usually is a definition of irregular cycle is basically when is early or delayed greater than 7 days and 3 consecutive cycles. And menstrual flow can be normal in this situation. And uterus can be normal size or maybe slightly smaller. And there could be not many other symptoms. And if this is something that's been going on for a while, we need to take a look at whether or not there are causes that we are not seeing. Now, if you have irregular menstrual cycle, that's only a few days apart. That may not be too much of an issue. But when you start talking about 7 days apart, there is definitely some dysfunction here that we need to take a look at. So we're going to differentiate between liver stasis and kidney deficiency and a combination of liver stasis and kidney deficiency. In liver stasis, the blood flow quantity may be more or less dark flow and frequently or with clots. There is usually abdominal distension and bloating. There's chest distension and the pulse is usually wiry. In kidney deficiency, the quantity is usually less. There's pale flow, minimal clots, lower back soreness, and the tongue is usually pale and the pulse is usually thin and weak. And in a combination syndrome, this is where the quantity can be more or less, dark or pale flow or with clots. There's usually abdominal distension, chest distension, hypochondrial distension, lower back pain, pulse is usually wiry and thin. So the treatment in liver qi stasis, we want to circulate qi, pacify liver, and regulate menstruation. In kidney deficiency, we want to tonify kidney and regulate menstruation. In a combination syndrome, liver stasis and kidney deficiency, we want to pacify liver, tonify kidney, and regulate menstruation. So if we look at the herbal treatment for liver stasis, usually we would use xiaoyao san as a base. So you might want to use this particular formula or modify such to treat this condition. And xiaoyao san, as you know, is a combination of caihu, danggui, baisao, baizu, fuling, bohe, and senjiang. Very widely used formula. And if you have clots, you may want to add dansen, salvia in there, yimu cao, neonori, xianghu, saiperi, and yuanhu into the mix. In a kidney deficiency situation, we may want to use formula such as gu yin jian. And gu yin jian is a combination of 2狮子, 熟地, 三茱萸, 人参, 山药, 炙甘草, 五味子, and 远志. We can add 杜仲 and 续断 if there is stronger or more severe lower back pain. Now, in a combination syndrome, we usually would use Dr. Fu Qinzu's very famous formula called 定金汤. This is a formula that pacifying liver and at the same time strengthen the liver and the kidney in essence. 8 herbs, beautiful, well-composed formula. To this day, many physicians, TCM, OBGYN professionals love to use Dr. Fu Qinzu's formula. And it's actually very important for us professionals to really read his book. His formulas are small quantity in his formula, but it does work really well. Anyway, this formula, 定金汤, is composed of 柴胡, 荆芥, 当归, 白芍, 山药, 茯苓, 菟丝子, and 熟地. So you have basically 柴胡, 荆芥, 当归, 白芍, pacifying the liver. Then you have the 山药, 茯苓, 菟丝子, 熟地, helping to strengthen the kidney. 茯苓there kind of help to strengthen the spleen. 菟丝子, 熟地, obviously, for the kidney. So it's a wonderful formula put together for this combination syndrome of liver stasis and kidney deficiency. Now, it's very important to focus on other management, focuses on other things such as emotional management. A lot of times there's some emotional component So we need to counsel the patient and look at how we can help the patient to become more emotionally stable. Second, we need to also look at the stress level. Take a look at what we can do to guide and counsel our patients to manage their stress better. Give them proper tools, give them proper techniques that they can learn to manage their own stress and reduce stress, and also trying to find the source of stress and trying to see if we can eliminate that. Third is sleep. Sleep really helps one to really recover. So we want to take a look at how is the patient sleeping, and also look at the sleep hygiene and whether or not this patient has proper sleep on a regular basis. And also really focus on eliminating or reducing time zone change travel. I have patients that has irregular menstrual cycle because she travels excessively, especially going across time zone. And that can really throw your circadian rhythm off and your endocrine system off, and that can cause a lot of irregularities. So in summary, in liver qi stasis, we want to use 逍遥散. In kidney deficiency, we want to use 固阴间. In combination syndrome of liver stasis and kidney deficiency, we want to use 定金汤. So let's look at the acupuncture treatments. In the liver stasis, we can use bladder 18, liver 14 point, conception vessel 3, liver 3, spleen 6. And we will use a sedation method in this situation. Now in kidney deficiency, we want to use conception 6, spleen 6, bladder 23, bladder 20, stomach 36, kidney 8, and we want to use tonification method or even with moxibustion. Now, if we have a combination syndrome, we can mix and match some of these points. I personally like to use conception vessel 6, liver 3, conception vessel 3, spleen 6, stomach 36, pericardium 6, and I would probably do an even method in an acupuncture technique. So going back to this case of irregular menstrual cycle by Dr. Wang Mianzi, this 32-year-old irregular menstrual cycle for several years. She exhibits dizziness, restlessness, poor sleep, pelvic cold to the touch, leukorrhea, sore back, chest is tight, hypochondria tightness, has used Chinese herb focus on pacifying liver, activating blood with no relief, but further aggravation of these symptoms. Pulse is wiry, left chin is small, the right is deep, tongue is pale, colon is white. Obviously, if you look at this, definitely this is not just a liver qi stasis, probably a combination syndrome of liver and kidney issue, as well as blood deficiency issue. So Dr. Wang diagnosed this patient as a blood deficiency liver stasis, and he believed in this situation, blood deficiency is the cause and liver stasis is the manifestation. So while this patient has been using liver circulating pacifying herbs only, this does not help because the cause was never treated. In fact, it made the condition worse. So what he wants to do in this situation was to nourish blood as the primary treatment principle, and regulate liver would be kind of like within itself, still under primary, but is more secondary under the main treatment. And in the second treatment, he wants to also strengthen the spleen and warm up the kidney. So in his formulation, he devised a formula of 生地、当归、赤芍、白芍、柴胡、川念子、白术、茯苓、酸枣仁 to help with sleep, 自远志 to help with sleep, 陈皮、仙人皮、红花、杜仲、丹皮. So you can see there's some kidney tonics, there's some stuff to strengthen spleen, there's a lot of stuff that circulates qi, pacifying liver, but also strengthen the blood. 7 bags, 1 bag each daily. And on the second visit, the patient comes back, the dizziness decreased, sleep better, there's less chest and hypochondriac distension, emotions are better, less leukorrhea, pulse is softer and less wiry, tongue coating is, the root is peeled, and liver stasis is decreased, but the in blood is still deficient. And the mother of liver is kidney. Therefore, he decided, we call it 以鬼同源. He decided that let's get rid of the 红花, get rid of the 远志, get rid of 陈皮 and 杜仲. Let's add more kidney tonic in there. 熟地, 枸杞子, 怀牛膝, 党参, 自香附 and 生姜 into the mix. So prescribe 10 bags of tea for her, 1 bag every day, and have her come back, and her condition completely recover, her period become completely regular, and her symptoms are all gone. Dr. Wang Mianzi, unfortunately, is not with us today anymore. He was born in 1923, deceased 2009. He is a 19th generation practitioner of TCM in his family. Extraordinary educator. In fact, if you note our formula books in Chinese as well as some is translated into English, was written by this particular professor, Dr. Wang Mianzi. Very reputable, especially his focus and his strength has been differentiation of syndrome and any kind of writing in formulations. So thank you very much for spending time with me today on irregular menstrual cycle. And I will look forward to see you next time.